All right, boys and girls, here we go. Video lecture. This will be a short one. Important we cover this material though. Body region and cavities. Let's go ahead and go through this. So, our body has different regions on it, and each region is kind of made up of a cavity which protects certain things or holds on to, encompasses certain things. Okay, so we have the cranial cavity. I think we all understand this is the head. The brain is located in the cranial cavity. It also, if you can see here, represents also the spinal column as well. Thoracic cavity is your chest, thoracic cage. Inside this, you're going to find your heart and lungs. Diaphragm is the, I'm going to tell you right now, principal muscle of respiration. You can hear me say this over and over again. It is the reason we breathe. It is the muscle that allows us to breathe. It also is the division between the thoracic cavity and the abdominal cavity. The abdominal cavity itself is housing all of our organs that we possess, obviously, the majority of our digestive organs, excuse me. And there is very little protection in this area, with the exception of muscle and your spinal column on the backside of the abdominal cavity. And then we have the pelvic cavity as well, which is protected by the pelvic girdle, the hip bones, and the coccyx of the spine. And basically, we're looking at reproductive organs in this area that's housed. Okay. So as we talked about the cranial cavity, this is the brain actually is inside the cranial cavity. It's surrounded by cerebral spinal fluids that allow the brain to kind of float, pull nourishment out of that fluid, and give it some protection and ability to function properly. We have a very thin bone. The skull itself is actually fairly thin that wraps around it, but it's extremely strong and well protected in that respect, with the exception of severe blows to the head. I'm sure we've got some students here that have had concussions before, and this is basically the brain bouncing back and forth inside that skull cap, hitting the sides of the bones, and can in some cases cause a little bit of bleeding as well. So that's important to understand. It's the cranial cavity. Thoracic cavity. Now, what you're looking at here is a picture of a thoracic cage opened up. This is a cadaver. Obviously, a patient's been deceased for a while. These are the lungs on either side, and then we have the heart that's located in the very center. And again, the protection we have here is actually the rib cages, the rib cage that actually floats around the entire thing to protect the heart and lungs in that thoracic cavity. Okay, abdominal cavity. You guys will be doing some work with this, maybe not necessarily today, but you will be doing some work on this, and that's understanding the organs that exist within the abdominal cavity. And there's some different things we need to understand here. We'll definitely get into this. But this shows you the abdominal cavity divided into 4 quadrants. We have what's called the right upper quadrant, or the RUQ. We have the LUQ, left upper. We have the RLQ, which is right lower, and the LLQ, which is left lower. And so each organ is going to be found specifically in different portions of this of these 4 quadrants. And so when I'm assessing a patient, feeling around, I can actually identify what organs may be concerning at some point in time. If there's injury, pain, deformity, or more importantly, distension, rigidity in the abdomen, depending on where that is located, can kind of tell me which organs may be actually injured at the moment. So body regions and cavities, again, we're looking at the pelvic this time. The pelvic region, again, it's a open space within the pelvic bone that basically encompasses the reproductive organs. For females specifically, males more on the outside, but we have space there for the reproductive organs, and we also have space there for bladder and that sort of stuff in that area of the pelvic cavity. As I mentioned, this was a short PowerPoint. You guys should have notes that you were taking while you're going through this, and there will be a Friday wrap-up like normal. So please make sure you take care of the Friday wrap-up. And as long as you guys are finished, you are free to do what you need to do. And if you have any work you need to take care of here in class, please do so. Guys, have a good day.